they have a different kind of build out of how they are able to function in Virginia. But he primarily worked with a lot of athletes, primarily worked with a lot of specifically golfers and tennis athletes. So he's utilized a lot of breathing. And so Kieran has moved in now to our fire department position. So he's the head athletic trainer with San Antonio Fire Department. We also have an assistant down there for him now as well. And then Lauren, those of you that get to deal with scheduling and things like that, get to deal with her. Lauren and I will go down and help them as needed. But they get to kind of bring a new dynamic to what they're doing down at the fire department and utilizing a lot with these guys. So obviously they see a ton of different injuries, ton of different things, but he brings a different dynamic, and going and working with him is extremely beneficial, and it's helpful because being somebody that thinks I do a lot of different things, he does way different things than I do, and it's great, and I love it, and I love seeing his adaptation to, like, we're doing the same thing, but it's completely different. And adding that to your tool bag and kind of working that with that, it's been great to get to use and get to kind of play with. So, Kieran, come on, man.
Thank you, Sean. It's great that he gets to bring me up here as the closer at the end of the day when everyone's just done, you know. So thanks for doing that, Sean. But yeah, I come from a little bit of a different background. Like he was saying, I operate a lot in Virginia. I was educated there. I spent a lot of time in physical therapy clinics, sports performance clinics. I also spent 10 years as a high school athletic trainer as well, until coming here and joining as the head athletic trainer at the fire department. One of the first things that I usually have to kind of get across to people is that they see the cool logo up there, and I get to work with firefighters every day. They're not really that athletic. Every once in a while, like, yeah, we have some in-shape guys, but there's still a lot of the old guys that are still there too. So a lot of where I work is there's an entire wellness department where we're dealing with guys that are, a lot of them are overweight, high cholesterol, diabetes, high blood pressure, things like that, as well as they have a very physically active job and they are tactical athletes. We'll put that in quotes. And we'll kind of go through that as to why breathing is a huge thing that we really try to focus on. And as we go through this, like I said, I'm the last one of the day and everything like that, so I'll try and kind of make this as down to earth as possible. Like Sean was saying, one of the best things that you can do coming up as a presenter is give you guys a bunch of stuff to take right back to your clinical practice and be able to implement today. And that's kind of how I built this, so it may not be as technical as some of the other PowerPoints, but I did that on purpose. I am a smart guy, just want you to know it. So it's built that way. All right, so here's the objectives of why we're here. One of the big things is breathing techniques, why bother, right? I mean, we all seem to be breathing just fine, so why bother? So we'll kind of get into some of the anatomy about it, some of why breathing actually matters during, whether it's manual therapy or corrective exercise or when you're working with the patient. And we'll kind of go how it all builds together, comparing movement patterns of proper breathing versus improper breathing, some of the things that you can kind of scout and look out for with your athletes. And then in the end, we'll kind of put it all together with some case studies. So just like anything nowadays, everything has to have evidence-based practice behind it, right? Because basically, when you're working with any patient, any client, any athlete, you should be able to cite research as to why you're doing what you're doing, right? If you can't actively explain to one of your patients or to an athlete why you're doing what you're doing, probably shouldn't be doing it. They're not gonna have a lot of confidence, they're not gonna have a lot of buy-in in what you're doing. Like I said, I work down the fire department. It's a very blue-collar environment, so I have a guy come in and, you know, I start talking to him about, all right, well, I want you to start breathing while we do these exercises. We're gonna go over some breathing techniques, and the first thing I get is, okay. So again, you gotta have to kind of break through that barrier, and the more research and the more education that you have behind your belt, the more you kind of get buy-in and establish that rapport with them. So these are just some of the research that's out there, basically just using corrective exercise, using postural correction and stuff like that, and fixing breathing techniques can actually improve performance. It can decrease pain. It can also help a lot of, like I said, we deal with people with high blood pressure. They're in a very stressful environment. Athletes being the same thing, they're under a lot of stress. So it affects a lot more neurologically and physiologically more than just breathing in general. So again, one of the big research takeaways, because again, you can read the research that's out there on it, but one of the big things I talk about is this integrated stabilizing system of the spine, okay? And again, my population is a little bit different, working with firefighters and things like that. Some of you working with a more athletic population, backs, spines, cervical spine isn't necessarily something that you come across a lot, especially those of you that work in high schools, colleges working with younger athletic population. However, these things actually are important with any type of performance or any type of exercise you're going to have them do, right? So this is simple biology. But basically you have the short intersegmental spinal muscles, the multifidi, the deep neck flexors, the diaphragm, the abdominal wall, and the pelvic floor. They all work together in order to create spinal stability. Now, one thing that's out there in the rehab world and in the strength and conditioning world is obviously everybody talks about core. First thing you start talking to your athletes about when you're doing any type of exercise, you start talking about core. Well, mostly you kind of have to re-identify what we're talking about when we're talking about core from a clinical standpoint or from even a performance standpoint. And we're talking about basically a box that goes from the top of one shoulder to the other shoulder to the bottom of the knee to the bottom of the knee and everything anterior and posterior of that, okay? So you can see how all those muscles come together and make this spinal system that if we do not have a stable spine and we do not have spinal stability, we're not going to have good performance, we're not going to have good core control, we're not going to have good motor control, and then it just cascades from there, okay? So just keep that in mind as we kind of go through some of this stuff. All right, so what are the biomechanics, all right? So again, it's the end of the day, so I'll ask these questions. Most of you won't answer anyway, but does breathing affect all forms of movement, yes or no? Good guess, yes, okay? Obviously, I'm talking about breathing, so the answer would be yes, okay? Does breathing change our posture? Yes, very good. Okay, so yes, breathing changes your posture. Improper breathing is going to create bad posture. And then what anatomical structures are we talking about? Obviously, one of the things that I think that gets overlooked or missed when we talk about breathing exercises and things like that is, of course, we're all breathing, all right? Otherwise, we're dead, right? But when we're talking about breathing exercises or diaphragmatic breathing, we're talking about the articulations between the ribs, the sternum, the thoracic spine, okay? So we're talking about how that part of the body is moving. And if you have restrictions or you have issues with that part of the body, that's going to cascade above and below, okay? And again, this is one of those things that I think gets kind of overlooked because we tend to look at like the big picture, right? You have an athlete or a firefighter that comes in and the first thing they say is, you know, my shoulder's really been bothering me. Oh, how long's it been bothering you? 6 years. Cool, let's take a look at that. And the first thing you want to do is look at what? The shoulder, right? Well, the shoulder's a ball and socket joint, right? There's some stuff going on there, yeah, for sure. This has been going on for 6 years, right? They've obviously been working, dealing with kids, like living through it, so it hasn't really affected them that much. Where's it coming from? You know what I mean? So don't overlook the big picture here when someone comes in complaining about neck pain, shoulder pain, upper trap pain, things like that, and kind of just pay attention to the way they're breathing, kind of pay attention to that thoracic rib cage area and things like that. And you can do it just while talking to them. Just don't be weird about it, okay? You should be able to just not stare straight at them and just be like, you're breathing weird, right? So you should be able to take a good picture of that in your mind and think about these structures that are moving, right? And so there's some breathing patterns that you kind of look out for. So there's just a great look at the anatomy there of everything that's involved in, like I said, the rib cage, the sternum, your thoracic spine hidden back there. And then look at all that musculature that's there, right? We often forget that you actually need muscles to breathe. It's not like an airbag, just inflates, deflates, right? You actually need some neuromuscular control. You actually have muscles that actually control breathing and actually do the breathing and respiration, right? So if someone comes in for, like I said, shoulder pain, and we want to do corrective exercise or do some type of mobility for the shoulder or something like that, why don't we address this musculature at the same time, right? And it's easy. We can do it while breathing a correct way, while doing whatever corrective exercise or whatever mobility or manual therapy you want to do, right? It's just another way of addressing it. And the cues are super simple. But again, it goes back to what I said before with you have to know why you're doing what you're doing. You have to have some evidence behind it. Otherwise, you get responses like I do, which is, I breathe just fine. Been doing it for decades. Okay. All right. So, messed it up. All right. Again, I put that in the slide, and I keep saying it over and over on purpose because this is literally what I get told all the time. I breathe fine. Yeah, you do, okay? But we could do it better, all right? And specifically, I put this picture on there because with the population I deal with, we get a lot of postural issues based off the equipment and gear that they use. The equipment and gear that they use is about 60 pounds, right? And you can see right here the perfect anatomical athletic position this dude is in. I mean, that is, yeah. And he's breathing just fine through a straw on his back, right? Because the other difference in the population that I deal with and stuff like that is that they're not truly breathing normally, especially when they're in a fire situation, especially when they're in some type of tactical situation. They're not breathing normally, and they're not breathing normal oxygen. Anybody ever breathed out of an O2 unit or out of an O2 tank like this? Yeah, it's fun, right? Is it regular breathing? No. Does it feel like you're getting oxygen? You feel winded all the time? Because it's not the same gas exchange, right? But the thing is, if we're not training that when we're not wearing the equipment, how much is that exacerbated when you put the equipment on? Make sense? Hopefully it makes sense, because that's what this talk is about. And I'd be a terrible speaker if it doesn't make sense. All right, so think about the cues when performing exercise as well in this position, okay? So the cues are super simple. If you have somebody doing scap squeezes, right, or you have somebody using flies or reverse flies or something like that, super simple. Just look at their biomechanics and things like that. Are they actually using their intercostal muscles? Are they actually inflating the lung and deflating the lung, right? Are they actually going through a proper breathing motion? And when you're behind somebody, and I get it, like coming from the clinical setting and stuff like that, I remember one day, the way it works in Virginia, just so you know, in some of the clinics is that you have one athletic trainer and we're responsible for like corrective exercise or self-mobility or something like that. And we work in teams of like, one of the clinics I worked at had 2 physical therapists to 1 athletic trainer. So they do the manual therapy for 30 minutes and then we get the patient for 30 minutes to do corrective exercise, which is real fair because the physical therapist gets 1, we get 2. But that's okay. We'll get into that, right? But when you get that person, right, and you're seeing, at one point I saw, I think, 36 patients in a day, right, doing corrective exercise, because I see them for 30 minutes, revolving door, get in, get out. So as I'm behind somebody and I'm looking at their thoracic spine and stuff like that, and I'm on my 14th or 15th patient, yeah, I'm like, breathe, okay, deep breath, great, right? You have to know what you're doing. You have to be, because if you're saying it like that, then your patient's checked out, right? And you're not getting the therapeutic benefit. You actually have to be looking at their thoracic spine, look at their scapula, see if they're hunched in like this, see if they're just, this is tough, right? Or are you actually like engaged? Are you actually like making them go through the correct posture, go through it's all about the setup, right? making sure that they're in the correct anatomical position to breathe properly, unlike the guy in the photo that I just showed you. So this is basically the new human position, okay? All of you are pretty much doing it right now, right? Because we have all this cool technology now. We have laptops, we have phones, we have iPads. Like, this is literally everybody from the age of like 8 years old to 16 years old right now. How many of you work in high school settings? Yeah, this is the high school baseball player right now. And of course, then we ask the high school baseball player of 7 hours of sitting like this in a desk to then come out and be like, let's play 2 hours of baseball. Cool, my shoulder hurts. Why? Because I'm in a kyphotic position literally all of my day, and I spend less than 25% of my day in a proper athletic position. And you can put this, I say baseball because that was one of the research articles that I read, was about collegiate baseball players and high school baseball players being in this position and being in the desk, and then having to come out of it to do overhead or throwing sports, right? And so the effect of postural breathing and proper breathing to correct postural issues and relieving a lot of the stuff that they're getting the overuse throwing mechanics. So again, are we using proper biomechanics? Are they doing it? And again, when you're doing this and you're working with somebody, you really are exaggerating the movement, right? You're exaggerating the breathing. You're exaggerating, put them in that upright position, get the neck back, like set them up in a pure, overly, it's gonna feel weird for them because this is normal, right? This is how we're all comfortable now, and we all gotta reverse that. But the other thing you can see by this picture is look what it's doing to the diaphragm. Does everybody see that? Yes, no, half of you are asleep. It's okay, all right? But you can see what it's doing to the diaphragm and what it's doing to your lung capacity, right? So if you're in that position, you have reduced lung capacity, you're not functioning properly, right? And again, this is just an example of, like, I see people from impingement, trigger point, shoulder pain, neck pain, scapular dysfunction. All of it is corrected the same way, right? And all of it kind of goes back to this specific example. So there you go. That's half the people that come in and see me, right? How's this movement going to be? So picture number one, that guy's going to do scapular rows. Yes or no? He's going to do them. They're going to go great, right? And he's going to blow through them. He's like, this is easy. Yeah, because he used absolutely no posterior chain, right? What about if I put him in the second position, and then I have him do scapular rows, and I pay attention to his breathing? What happens? This has become the hardest 8 reps that I've ever done in my life, right? Because I took him out of that kyphotic position. I took him out of what's normal for him, right? And then I put him up in what's supposed to be the normal position. Does that make sense? Maybe. All right? So should he be doing mobilizations or strengthening everything in position 1 or position 2? Thank God most of you got it right. Yeah, thanks. Half of you were paying attention. All right, so yes, we want to cue him, all right? So let me give me an example of position number 1 to position number 2. What's one cue that you could use for him? Stand up straight. Yeah, that's the mom answer, right? Because we were all told to sit up straight and everything like that. What do you think this guy's going to do when you tell him to sit up straight? All right. That didn't work. Anybody else? What other cues can you use? Shoulders back, right? One of the number one things that I find as a cue that is one of the most difficult things for any human being to do is scapular depression. Not retraction, not elevation, but you have somebody in this position and you tell them to come up straight and then drop their shoulder blades. Everybody try it right now. Probably the hardest thing we'll do all day because you've all been sitting in kyphotic, right? So bring your shoulder blades back, now drop them down. I just saw half of you just be like, oh, it's weird. My trap's gonna break off, right? Because we're so upper trap dominant and lower trap deficient, right? So again, that's the number one cue that will be the most difficult for any population is scapular depression. All right? What is the point of even putting them in that position because this all seems so simplistic, right? Some of the coolest thing you ever learn in any type of conference or anything like that is the most simplistic stuff. It's like I went to a conference, I learned how to breathe. Nice. Tell me about it. No one will ever say that. But this is what you're doing, right? You're improving that blood oxygenation. You're allowing a more efficient gas exchange. You're massaging your abdominal organs. That sounds super weird, right? But if I went back to that kyphotic slide that I showed, when you're hunched over like that, what are you doing to your abdominal organs? They're compressed, and you're shearing them. Whereas I come up here, now I'm breathing, I'm massaging them. Let's go home and tell everybody that. Everybody be like, it sounds like a great conference. All right. You're going to reduce stress levels, cortisol levels, and activate this rest and digestive response. That's just a cool bonus. Nothing to do with corrective exercise or what we're trying to achieve. But again, we're trying to treat the patient as a whole, right? And like I said, I deal with a population that have high cholesterol. They're in a super stressful environment. They're stressed out a lot of the times. They're responding to stuff that like we probably should never see. So that's a big benefit in my area. Probably beneficial for a lot of high schoolers too, because they're all stressed out for no reason. All right, so you get a little bit of therapeutic benefit there as well. And you get to relieve tension in the neck and shoulders, contributing to good posture. And as soon as we start correcting posture, you start seeing a lot of this impingement syndrome, neck pain, upper trap. Oh, I think I slept wrong. All that type of stuff, because it's all coming from this postural kyphosis that we're all in. So this is a step-by-step guide. I won't go over it because you all have access to the PowerPoint. Sean's put it up there. But basically, diaphragmatic breathing is one of the best things you can do. A lot of it's on your iWatch and a lot of apps that are out there now and everything like that. Has anyone ever done one of those? They're usually more for meditation. For those of you that have an iWatch or anything like that, there's a respiratory one on there. If you've ever done one, the weirdest thing about it is that we all realize when you do them that we just don't breathe for long enough. I think the count on there is 5 seconds, and then a 5-second exhalation. Everybody try it now. Try and inhale for 5 seconds. Ready? Go. 1, 2, 3, 4, 5. Exhale for 5. 1, 2, 3, 4, 5. Who felt like they were suffocating? Yeah. It's weird, right? Because we don't think about it. And right now, we're doing literally no physical activity. We're not exercising. We're not doing any mobilizations. We're not doing anything. We're just sitting. And it is difficult to inhale for 5 seconds and exhale for 5 seconds, right? So imagine what's happening when they're doing some type of athletic or exercise-based movement. All right? So one of the cool things I found with cueing your person to breathe and everything like that when it comes to manual therapy, for example, this is a position that we put a lot of the guys in because we see a lot of low backs and things like that. And just by doing breathing techniques in this position and having them take a deep breath, you can actually get cavitations in the back while doing this without having to do a grade 5 or grade 4 mob. You can reduce the amount of pressure and be a lot gentler with people that have low back pain or any type of issue and mobilize them by getting them to just use those intercostal muscles, use the rib cage and everything like that in order to mobilize. Cool, right? Anything that we learn that makes our job just a little bit easier is great, so that you don't retire with arthritis in your hands from mobbing everybody and trying to crank on athletes for years, right? All right. So corrective exercise with proper breathing. This is an example of one of our guys. They came in. He was coming off of shoulder surgery. Take your time with the setup. He has really good form, right? That was just for the picture, okay? So it's all about proper setup, right? We had to sit him there for at least 30 seconds to figure that out, all right? But to cue him to get into that position, take your time. Before he ever starts pulling that kettlebell, well, put him in the proper position and everything like that. Let him take a couple of controlled breaths. Put your hands on his rib cage. Let him expand into your hands, deflate into your hands, right? So he gets the idea of the breathing, and then step away. One of the things I find with whether it's corrective exercise or performance or strength and conditioning or anything like that, we get lost in these sets and reps, right? So it's like you'll be working with somebody and you'll say, all right, we're going to do 2 sets of 10. Okay, great. They do 2 really good ones. And we just finish that up. What do we accomplish? 2 reps, right? Because we send a neurological signal and a motor pattern that got reinforced in a bad way. Whereas if we focus on the quality of each and every movement and the proper breathing, we actually get more therapeutic benefit. Does that make sense? So the number one thing to take back to wherever your setting is, don't get lost in the sets and reps, because they'll do what's called rep chasing, which means that you give them 2 sets of 10, they'll do 10 reps, but they'll just do 2 or 3 like good, and then they're like, this is hard. There you go, there's your 10. Thanks, all right? So focus on the quality of movement and the quality of breathing. So there's another example of some of the exercises that we do. And again, a lot of this is just cueing breathing, especially up there with his legs up at 90 degrees, getting him to relax, getting a nice flat back and everything like that. Do you think his breathing is going to be great the minute I put him in this position? Nah. Now all of a sudden he's not inflating his lungs. You're going to see this difference in breathing pattern. You watch his rib cage, it's not going to inflate and deflate the right way. So the first thing you do is start cueing breathing. Now one of the exercises that we do here is, this is for abdominal bracing, is he's now going to squeeze the ball between his knees and his hands. What do you think that did to the breathing? Stopped it altogether. So now he's just holding his breath. He's got great abdominal pressure though. That spine is secure for about 5 seconds until he passes out. So again, getting them to do spinal contraction, getting them to do muscle activation and stuff like that with proper breathing is actually a little bit more challenging than you would think. But again, it takes you as the clinician to see the benefit in it and to actually go through the process of cueing them and making sure they're doing it properly. All right, so like I said, we'll put this together. Sean, do I have time? I'll make it like 2 minutes. I'm just going to go for a quick example. So say, for example, like I said, the population I'm dealing with, poor diet, poor nutrition, they work 24-hour shifts, they're working with 60 pounds of gear, and their oxygen consumption is super irregular, all right? So Sean, I'll borrow you since you're the closest to me. So he's going to come in, he's complaining about back pain because it's 99% of what we see, because it's basically a spinal clinic at the fire department, all right? So the first thing we're going to do is we're going to cue him to lay down on his back, all right? He moved very ungingerly for a back pain, but that's okay. All right, so right here, all we're going to do is we're going to look, and we're going to look at his breathing. Right now, you think he's breathing properly? No one has any idea. That's okay, all right? But you can, one of the things you can do if you just can't spot it and just look and see is if you put your hands just on his rib cage and talk to him while you do that. Don't just be weird. Okay? You can be weird just to test his breathing and just be like, weekend was good? Good, all right? But put your hand on his rib cage, tell him to take a deep breath. What you'll find with some low back pain and thoracic pain people is that they literally can't do this. This is something that when the rib starts pushing out, it affects the spine, and all of a sudden it can't, right? So then you would have him put his hands right here, right? One on the chest, one on the abdomen, and tell him to take a deep breath, and you want him to feel his chest rise into his hand as well as his belly rise into his hand at the same time. Does everybody see the change in what happened to his rib cage? Those of you that are closer? Yes, no? Okay? So now you saw what happened, right? That was an actual breath. There you go. So you can see how this changes things. Now, super simple, because that's super easy, and most people aren't going to see the benefit in that, right? So another thing that you could have them do is, let's go ahead and just raise this leg right here. Just hold this right here for me. Put this leg right here. Now, can you take a deep breath? It's a little bit more challenging, right? Any pain in the back? No. That's another thing to clear, because he came in for low back pain, right? Can he breathe without low back pain? Sometimes just putting them in this position right here, just the control or to hold this, is going to cause pain. Go ahead and lift this leg. Any back pain? No? Go ahead and take a deep breath. And then put your legs down. How'd that feel with legs elevated trying to breathe?
A little more difficult.
Yeah. Not a ton, because Sean's in shape, he works out, right? So he should be able to breathe. He's used to this stuff. But it does change your breathing. Thanks, Sean. All right? Any questions? Super simplistic. Hopefully that helps you a little bit. It gives you some direction, and it gives you something that you can take back and you can implement right away. All right? When we go to the breakout sessions, if you have extra questions, you can ask me if you come to my breakout session. If not, don't worry about it.
All right. As we start to transition now, we are going to go into our breakout sessions. The breakout sessions today, there will be one here. I'm going to move back here. There's going to be one here. It's going to be